For the last 7 years, I've had the pleasure of working with Dr. Phil Memoli, who's out of New Jersey, at the Institute of Nutritional and Systemic Dentistry, schools that we run on the East and West Coast. That's a plug. But what has really piqued my interest is Phil's grasp of dentistry from a clinical wet hand perspective to his outlook of the market of holistic dentistry in the future, where we've been, where we are, and where we're going. And I asked Phil if he would come out and speak today to give that perspective to our members. So without delay, I'd like to introduce Dr. Phillip Memoli.
I've had the honor of having a positive relationship with my board of dentistry, with OSHA, and with the Internal Revenue Service, okay? All in association with my practice. And part of what we've done is try to set up the institute to be kind of an application thing and to include these things that we learn the hard way: scope of practice, proper record keeping, proper documentation. When I got out of dental school, I felt I wanted to learn more about the holistic aspects of things, but I felt like I didn't really get trained properly. So I went out, I did all the Pankey courses, all the Dawson, all the John Coy's course, all the Frank Spear courses, every course I could take. For about 15 years, I worked 3 weeks and took courses for 1 week. And I have a very strong foundation in traditional dentistry. I feel in order to be a good biological or holistic dentist, you have to first be a good traditional dentist. And from my perspective of looking at the dental, kind of being on both sides of the coin, you're going to kind of see some of my reflections here. My friend Nani, a Japanese master during the Meiji era, received a university professor who came to inquire about Zen. Nani served tea. He poured his visitor's cup full and then kept on pouring. The professor watched the overflow until he could no longer restrain himself. "It is over full. No more will go in. Like this cup, you are full of your own opinions and speculations. How can I show you Zen unless you first empty your cup?" So kind of today I'm asking you to empty your cup. I'm going to speak on this subject because when we open our mind, that's when the fullest potential of creativity is available. We're going to talk about patients, dentists, dental philosophical models, the application of these dental philosophical models, the dental practice, what systemic dentistry is, and what we as dentists can and should do. Nostoi is actually an ancient Greek term. What it actually means is to return to wholeness. We're going to ask a lot of questions today. Our first concept is tragedy. And Aristotle says tragedy, in its simplest form, is when bad things happen to good people. And the question I raised here, well, is this fate or can this be changed? And what's the application for us as dentists? What's the application for our dental patients? When in a state of imbalance, and this means physical, mental, emotional imbalance, nostoi means to return to a state of harmonia. And to the ancient Greeks, that meant going back to Greece. It meant going back to a state of balance in harmony with nature. And it's represented in Aristotle in the golden mean. And in the Nicomachean Ethics, he talks about the golden mean in terms of defining, say, bravery. He says, in the middle, you have courage. On one extreme, you have rashness. On the other extreme, you have cowardice. He says, what's valuable? What can we build a civilization with? Where can we establish values? It's not with the rashness, all right, because there's no thinking there. And it's not with the cowardice, because we're not backing ourselves up with what we believe. Can harmonia help us in this dental profession? Do we as dentists, do we even as biological dentists need to go back to a state? Modern man is fundamentally different from ancient man in that the gods have been replaced by science and virtue has been replaced by technology. And as you notice, there's a huge movement in biological dentistry embracing technology. And the question is, will these values create harmonia or true health or tragedy? Man was born free and is everywhere in chains. Those who think themselves the masters of others are indeed the greater slaves than they. How did this transformation come about? Well, there's something called conditioning. It's the way we raise our children, what we tell them, who we want them to be, all right? What food we stick in their mouths. Okay, when my son was born, what happened was he was being fed the food that my wife's parents fed her. Well, he was getting rashes. Oh, we were told the rashes would go away. Well, what's happening? He was trying to get food that was what we would call toxic or allergenic, that didn't fit his diet. But there was a preconceived notion that this should be his diet. The clothes we wear, what we think, what we worship, how we raise our children, what political system is the best. I have a lot of Russians in my practice. They're into energy medicine, and they know a lot more about it than we do. All right? And they don't see any difference between our system and theirs. None. What it's okay to be addicted to. And what is it okay to die for? What does this cause? Dysfunctional people. When we condition people. And they form codependent relationships. And what promotes all this? Drama. Drama in our lives and our relationships prevents us from thinking about our present state of mind. In time, we get in the box. Poor relations, unsatisfying work, insatiable materialistic tendencies. Just how many times have people been married in this room? All right? In dental school, the professors used to brag about it. All right? Loss of physical, mental, and emotional health. Is there a pattern to this? Is part of biological dentistry to uncover this pattern? Or is it to fix them? Here, this is what I call the life cycle. All right, the people who are in this pattern. Stage 1, you are in a state of health, 0 to 30 years. But again, all of these years are different for everybody. You have unconscious habiting. That's when you're acquiring your conditioning. Here, our diet, our personality, our addictions, our tendencies. Unconscious awareness of health. Our body talks to us, but we don't listen. Why? Because we can party and not pay back. We kill the messenger. All right? And what do we use to kill the messenger with? All right? They shut off the warning. Here, stage 2, state of health dysfunction. Now, we're starting to become a little aware, all right? And it's semi-conscious here. And either we're going to go into, when we go into awareness, we can go into denial. And what happens is cognitive dissonance comes in here and says what? These aren't my addictions. This is my lifestyle. Okay? We use euphemisms. Stage 3, the midlife crisis. Here's what 40 to 60. Conscious awareness of health decline really sets in now. Say, hey, I'm getting old. I can't do what I have to do. But now cognitive dissonance, our friend, kicks in again, that little voice in our left ear. Here, denial. Here, it's not me, it's not my fault, it's my spouse. It's my employees. It's my family. Here, and then we go into a self-affirmation. Well, all I need is a new image, a new spouse. Well, if I can't afford a new spouse, I'll just get a girlfriend or a sports car. Okay? Cosmetic surgery, cosmetic dentistry, or biological dentistry. What's going to happen when this person walks into your practice? Is he going to go back? Can you help him back to a state of health? Stage 4, crash and burn. All right? This happens usually around age 60. Here, and people resign themselves. Here, disease is a normal part of the aging process. It's okay for body parts to get cut off or fall off. It's okay. I go see my doctor, he fixes me up, and I can go back to my lifestyle. Well, what's been killing this person? His lifestyle. At this point, what happens? Our people select a mortician, and a favorable exit strategy is worked out. I think you all know what I'm talking about. Here, again, those who think they are the masters themselves are the greater slaves. Confucius, 2000 BC. The young man spends all of his time pursuing wealth at the expense of his health. The old man spends all of his time and wealth trying to buy back his health. Now with patients, how can we break the cycle of dysfunction and return to harmonia? Here, for patients, they are asking themselves the question, the unexamined life is not worth living. They are starting to examine their lives. For dentists, well, we have two. First, we have to examine our lives. Next, we have to examine our practice. Patients are re-articulating their values from a wealth consciousness to a more health-centered consciousness. What happens when a shift of consciousness occurs? You get revolution. The wellness revolution. 10 years ago in 1994, the allopathic world was shocked to find out 50% of patients were using one form of alternative care. Today, it's 75%, and 50% are using at least two practitioners. Paul Zane Pilzer, in his analysis of the financial revolutions, identified two major financial innovations which revolutionized business and created paradigm shifts. Here, the first one, 1908, Ford came out with the Model T. The automotive industry was the first trillion-dollar business. In 1984, IBM came out with the PC. So that's the second trillion-dollar business. He's a government analyst, and he predicts that the third trillion-dollar industry will be the wellness revolution. And at this point, when he wrote the book, it was at 200 billion. Mind you, dentistry is at what, 60 billion? This is at 200 billion, and that's only counting health food stores and fitness centers. Here, chapter 1, why we need a revolution. In his book, Medicine and Dentistry earn little more than a footnote because of what he cites as arrogance and short-sightedness on the part of doctors, and we could stick dentists in there, medical schools, the government, insurance companies, the commercial food industry, and pharmaceutical companies. Now we have some awakened patients. What will they be looking for? Well, first, we have to understand, how do we identify them? Well, first, we're going to find that they're educated. More people are educated now. They want to know what caused it. They don't want us to fix it. They want it to be caused. You could have all the technology. Unless you know what the cause is, you're really not healing somebody. And they can identify spin. They don't want to hear anymore, and they don't believe that we don't know the cause of cancer. We don't know the cause of heart disease. They know this is not true. Proactive. They do their own research. They even know that the scientific research is biased based on who's doing the study. They don't rely on experts. They know what that means. Personal responsibility. They're shedding their conditioning. They're making their own lifestyle changes. So when we talk about the box, we talk about who's in the box, who's inside looking out, and who's really outside of the box. So these health-conscious patients, as I call them, they're out of the box. And they got out of the box by educating themselves, by being proactive, and being responsible. What are they looking for? They're looking for a practitioner who's going to take them to the next level. Not to fix them up, but to make them well. Who's our other patient? The investment conscious patient. And I call them inside looking out. They want health, but they can't take that step. Why? Because they're worried about how much it costs. They're looking for a bargain. All right? Instead of realizing that their health is their wealth, they contemplate health in terms of risk assessment. All right? How much is this going to cost me? What am I going to get out of it? And apply maxims like an ounce of prevention is worth a pound of cure. An ounce of prevention is worth your life. But they don't get it. And they can be very indecisive and act too late. Wealth consciousness. They're not even aware that the box exists. Okay? They're in it. All right? Health is not even given a thought until what happens? They lose it. Until the stray bullet that causes cancer or the stray bullet that causes whatever we don't know what causes disease hits them. All right? They're uneducated. That doctor's the expert. They don't even pick up a book or even look on the internet to see what's going on. They're reactive. The doctors ruin my health. And they're not responsible. I'll do whatever the insurance company pays for. Okay? Or I'll do what you say. It's not about doing what I say. It's about us coming to an understanding and you agreeing that this is the right treatment for you. What are their values? When forced by disease or infection to make a medical decision, conditioning forces them to follow what? They're going to default to the values of society because they don't know how to formulate their own values. Here, peer pressure. What are the masses doing? Oh, what does my family and my spouse want me to do? Expert opinions. Well, key question is, who are the experts? Are they the people who toe the party line? Those with the most titles after their names? Or those who are in the biggest buildings? Expedience. I want a quick fix. Disinfect, cut, and burn. So I can get back to work, so I can continue my lifestyle. That's their values. Out of those three people, who's most likely to break out of this cycle? The health conscious patients. And what are they embracing? They're embracing a new philosophy, and it's the philosophy of humanism. Here, human dignity is the ultimate principle. Every 1,000 or so years, this gets drawn up. This first comes out of the school in Athens, which is the theme of the school. The concept of humanism, that each person is important, and it's for them to decide what their destiny is and what their values are. Not the values of the state, not the values that Madison Avenue wants you to have. And what is humanism? It's basically co-therapists. The dentist as a healer and the patient as the co-healer, because where does healing come from? We don't heal anyone. We simply help them get to a state of healing. Man is the measure of all things. What are the health conscious patients looking for? A healer with the same, they're not looking for a dentist, they're looking for a healer. They don't care if you're biological or systemic or holistic or whatever. Excellence. They don't want mediocrity. They're not looking for the American value of franchise. Anywhere in the United States, you can go to any city and get horrible food. Okay? Me and my wife are trying to, we're coming to the opinion that, we can't retire in the United States. It's hard to find good food. At any rate. Cooperation. They're looking for co-therapy that's not fear-based, not authoritarian, and given options without an agenda. Do we have agendas? There are times the prince must know when to be a lion, and times he must know when to be the fox. Is this our philosophy? What is your dental role orientation? All right, and this is available in the literature. All right. First is the guild model. All right. Now, when we talk here about authority and responsibility, authority is omni-expert. And responsibility is accountability. Now, the profession in the guild model, and I'm talking here about the high priest of dentistry. In this model, the profession is an exclusive domain of knowledge and skills. The dental professional is an expert whose judgment should be followed and respected. The commercial model, high on authority, low responsibility, no accountability. The dentist sells his services and patients buy. It's a market. The doctor-patient relationship is basically a commercial exchange. The agent model, all right, low responsibility, low authority. You come in, you tell me what you want done, and me, the dentist, I perform it for you. There's nothing about safety. There's nothing about responsibility. And then the service model. This is the fourth model. High on responsibility, low on authority. These dentists approach their profession. Now, these models are what some of the boards look at when they're assessing how you act with patients. This is how I was judged. Now, you want to make sure that you're this model. These dentists approach their profession with a nearly selfless devotion, often sacrificing personal and familial needs in favor of serving their patients and the public at large. These persons see that they have been entrusted with special privileges and given this privilege are obligated to serve humanity. The public's health and welfare come first. Remuneration and rewards are of secondary concern, and it is assumed that they may follow in due course. Which dentist is most likely to be professional, ethical, a healer, a humanist? Which dentist practice will the health-conscious patient join? Which dentist are you? On here is my number. All right, and I was talking to some people before. When dentists find that they have come to the right place and you've heard them, most of my patients pay me up front. And it's hard for people to believe that. That's why. Call up, ask my receptionist. When they find the dentist that they're happy with and the treatment plan they think is going to help them, there's not going to be any hassle over money because it's not about money. It's about their health. If your enemy draws a circle around himself to exclude you, draw a larger circle to include him. Now, we're going to talk about the quacks, all right, the holistic dental model. What are its characteristics? Well, it's strong on regard for material safety. It's weak on technical dentistry. How about the poisoners, the orthodox dental model? Well, they have excellent technical dentistry. It's out there. They may not be practicing it, a lot of them. And what's their disregard for material safety? And I talk to at the New York meeting, sometimes 75 people a day, 100 people a day, and the mentality is that if they put something in their mouth and they make it out the door, it's not toxic. Okay, once they're outside the door and they're not having an allergic reaction. Also, I was told from someone in the regulatory industry that the word toxicity is not in the dental vernacular. And we'll see. It is now in the dental vernacular. In Chapter 8 of Phillip's Science of Dental Materials, the biocompatibility of dental materials draws on knowledge from biology, patient risk factors, clinical experience, and engineering. Although ignored for many years, biocompatibility is now recognized as a fundamental requirement of any dental material. It's here. You're practicing good dentistry. And what happens? We've heard about the amalgam wars. All right? With all the different philosophies in holistic, what's going to be next? When the amalgam wars end, the holistic wars will begin. Quo bono. That's the basic test. It means who benefits? Who benefits from all this division? who is our real enemy? And it comes back to foundational questions. Why did we originally become dentists? To help people or to make money? Who comes first, our patients or our politics? And here, how do we respond to difficult questions from our patients? Here, what if the patient asks this question? And next to me in my operatory, I write everything down. I heard amalgam fillings are toxic and can cause disease such as cancer, multiple sclerosis, and other neurodegenerative diseases. Further, I understand dentists and the dental associations are lying to cover up and hide these facts from the public. Well, dentist number one, no, these are fake assertions made by quack dentists who are motivated by greed and power. There is no scientific evidence to prove amalgams are harmful. In fact, we have been placing them for over 150 years without problems. I have them in my mouth and place them in my family's mouth as well. Do you think that I would do that if I thought they were harmful? Dentist number two, yes, you are absolutely correct. The truth is, the proof they are harmful is deliberately suppressed and kept from the American public. Furthermore, they have gone so far as to say they will take my license if I tell you the truth. Because of these lies and deception, I have left the association and dedicate myself to patients who want to rid themselves of poisons. Dentist number three. Dental science is currently studying the impact of dental materials on systemic sensitivity. Currently, no studies directly link materials to specific disease, but we realize this area has not been extensively researched, and we are now focusing on the subject. In my practice, for those patients interested in reducing their systemic sensitivity, we offer them some options which help them to achieve that goal. Which answers are reactive and harmful? Which answers reveal that there's an agenda? Which dentist would you go to? Which answer makes you feel good about being a dentist? More questions. Can my periodontal infections cause a heart attack or a stroke? I am pregnant. Can my gums have a negative influence on the health of my child? Well, these answers aren't controversial now. Okay, although in Europe, they've known this since 1982. Can my dental condition affect my blood sugar? I heard root canals are not safe. I want all of mine removed. Can unhealed extraction sites throw off infections into the body? Dentist number one. There is no evidence linking root canals to any problem in the body. Root canals are absolutely safe. Teeth should never be removed if a root canal can be performed. There is no such thing as unhealed extraction sites. There are no such things as focal infections. These are not proven and are outright fallacious. Any dentist saying these things should have his license taken away. The most recent volume of Pathways of the Pulp had a whole section stating that there's no such thing as focal infections, in outright opposition to what's being said in periodontal. Dentist number two. Root canals and extraction sites are dangerous sources of infections. The past president and founder of the Endodontic Association wrote a book in which he described just how dangerous these infections are and how they act upon the body to cause disease. Root canal teeth should never be left in the mouth. They are dangerous to your health. Dentist number three. There is a growing amount of evidence to show there is a relationship between periodontal infections in the body. Periodontal bacteria can enter the bloodstream and travel to major organs where they can begin new infections. The relationship between root canals and unhealed extraction sites is less understood. Again, adequate proof may or may not exist, as far as I know, regarding the spread of infections. I must stress I am not an expert on the research. More research possibly needs to be done, and I will pay more attention to this subject for you. The mechanism of periodontal infections causing systemic infections is now better understood. Is it possible root canals and unhealed extraction sites having the same flora can do the same damage? Is it professional and reasonable to be open to all possibilities? Is this not the basis of the scientific methods of hypothesis and inquiry, to be open to the unknown? Who knows what we're going to find in another year or two? Here, remember, bloodletting was common and was the standard of care 200 years ago, and it killed George Washington. But bed rest for 2 months was recommended after surgery and resulted in thousands of deaths. And this wasn't stopped until the 1960s. Hand washing before birthing to prevent infection was considered unnecessary, and most surgeons refused to do it. Semmelweis, the Austrian, who recommended it, was ridiculed and thrown out of the profession. How would psychologists diagnose these two models, dentist number 1 and dentist number 2? Well, mirroring, okay? What bothers us the most in ourselves can be found in our criticism of others. So when we call others quacks, what does that mean I am? And when we call others poisoners, what does that mean we are? We have met the enemy, and he is us. Let's talk about your dental practice. Ruskin, in his book on the Stones of Venice, all art is either instruction or infection. What is your practice? Instruction or infection? These are case histories, people that walk into my office. Ava, basically 7-year-old, her mother's in the holistic moms, breastfed, never vaccinated, never ate any processed food, ends up with decay. The tooth's restored, 6 months later, tooth becomes devitalized. Another tooth has caries, it's restored, it becomes devitalized. Will the dental models tell us what's happening here? The mother wants to know what's causing this. Okay, she was sent to an EAV person, to 2 of them. It didn't stop it. Sharon, I had a relatively good dental health for 40 years until 1 year ago I developed multiple decayed teeth, which quickly progressed into several root canals. The teeth were then crowned, and later these same teeth began to decay. 1 or 2 had to be extracted. She went the whole round of traditional and holistic dentists, asking the question, what caused my decay? What caused it? Everybody had something to sell her. My last dentist told me I needed a bite adjustment because I was grinding my teeth. Further, to counter the decay, he recommended bonded ceramic inlays. Are bonded ceramic inlays indicated with rampant decay? I reminded him of some of the previous teeth which were decayed and had bonding. And why wouldn't his bonded fillings decay like the rest of them? Well, his answer was that his fillings would not redecay because of the bite adjustment. I asked him, if my bite was unbalanced for the last 40 years, what accounts for it suddenly getting decayed? Can the orthodox model address these patients' problems? Does a holistic treatment plan of equilibration address it? Edward, I went to the best holistic dentist. This dentist everyone in this room knows, to remove all of my mercury fillings. I was starting to notice some chronic fatigue, and I wanted to treat it preventively before it worsened. After the treatment, I suffered from the following problems. Maldigestion. I lived on a liquid diet for 40 days until I could hold down solid food. Chronic fatigue. Formerly, I could sleep 5 to 6 hours and be completely refreshed. After dental treatment, I would still be exhausted after 8 to 9 hours, couldn't get out of bed. Tooth grinding. I had to get a mouth guard from another dentist because the first dentist wouldn't make it for him. Because I woke up every morning and sometimes at night grinding my teeth. When I got the mouth guard, I ground through it. My teeth were very sensitive to cold and I couldn't chew. Root canals. 2 teeth later needed root canals, one of which was extracted because the root canal failed. My chronic fatigue lasted 2 more years and was relieved by intense juicing. My dentist told me it was impossible for these things to happen to me as a result of his treatment. This actually, I didn't record. He wrote this for me. I have been experiencing a number of health problems, which included rashes, arthritis, constipation, and colitis. This is a patient. This in spite of the fact I lead a very healthy lifestyle and diet. I had all 8 of my amalgam fillings removed and replaced with ceramic hybrids. Quote unquote, the next best thing to sliced bread. Amazingly, the dermatitis cleared up, but headaches, generalized muscle aches, and arthritis occurred. Next, I saw a dentist who specialized in holistic dentistry who referred me to a naturopath for electrodermal testing. They concluded the fillings should be replaced. After 6 weeks of testing, he removed my fillings and replaced them with glass ionomer. When he polished the fillings, dust went into my eyes. By the next morning, my eyelids had so filled up with fluid, I had to go see a doctor and take steroids and antihistamines orally. After 3 weeks, I felt constant nausea. I couldn't handle perfumes, cigarette smoke, or drink coffee. The dentist said he had never seen a patient respond negatively to glass ionomer fillings. I was able to lessen the nausea by taking charcoal and chlorella, which gives us some hints about what's going on. After doing some research on glass ionomers, the patient did the research. I found aluminum and fluoride can cause nausea, and polyacrylic acid causes edema. I went to another dentist to replace my fillings, but he said glass ionomers do not leach and didn't want to treat them. I thought that was strange, since I have a strange taste in my mouth and a horrible feeling in my stomach, which could only be from the fillings. Pamela. I was going to my regular dentist who recommended the replacement of 2 fillings. I told him I was concerned about the mercury in the fillings and wanted non-mercury containing alternatives. He laughed in my face. After arguing with me and telling me he was the expert, and that's what he called himself, he finally agreed to place composites. While the fillings were being placed, I sensed he was pressing the fillings into place, similar to the placement of amalgams. I asked him if he was placing the fillings we agreed to, and he said yes. Before I left, I went to the restroom and looked in the mirror to find he placed 2 new silver fillings. He refused to discuss it with me, as he said he started his next patient. When I went to the receptionist, I was handed a bill which I refused to pay. Receptionist said, "We'll just put you into collection." Thereafter, I went to several alternative dentists and settled upon one in the city who assured me she was the best. It was agreed to place composites, and I inquired about the proper precautions. Instead of answering my questions, she assured me that my case was a standard case and all the proper precautions would be followed. Although she used a rubber dam, I could smell burning metal, which irritated me. After the appointment, I began developing brain fog. She assured me this was temporary and to continue the treatments. However, the brain fog worsened after each treatment until I stopped. I asked her if I was susceptible and if there were a physician who could help me. Again, she reassured me all would be well. After 6 months, I started to have sensitivity in the teeth she worked on and consulted another alternative dentist who found leakage and a dead tooth. By this point, my brain fog became so severe, I was fired from my job. She got another job, was fired. Another job was fired, okay? Because of the stress, she argued with her husband. She became divorced. She became depressed and had to go on Prozac. I want my life back. That's her chief complaint. Anna, I am in the scientific field and I am familiar with heavy metal toxicity. I went to several of the most respected dentists who, for some reason, did not want to place alternative fillings. For a simple filling, we're talking like an MO on a premolar, they told me that it was either an amalgam or a crown. At this point, I decided to remove all of my mercury fillings and found a dentist who convinced me to also remove my root canals. I was given a book to read and told her I was vain. I want my teeth to look good. She assured me I would be satisfied. In one visit, I underwent general anesthesia, had all my fillings replaced, and my root canals removed. When I woke up and saw my teeth, I almost died. I was given a denture which was uncomfortable and ugly. I could not chew and felt I could not find my right bite. A new denture was made, which was just as ugly, uncomfortable, and non-functional. She was a nice person, but at this point it became evident to me she had no idea on how to help me. I asked her to refer me to someone else. She told me this was the treatment plan any dentist with her training would provide. I thought to myself, this is crazy. What dentist would leave a patient uncomfortable and unable to chew? To say nothing of how ugly it was in the era of cosmetic dentistry. I realized I am a dental cripple. Was it lack of professionalism and ethics on the part of these people? Was it the lack of proper dental training? Was it a lack of sensitivity or knowledge? Or is it the lack of a proper model? And again, I want my life back. Because imbalances, even if we're trying to do the right thing, results in bad things happening to good people. Tragedy. So, after looking all this, I came to the conclusion, my friend's an engineer. He designs jet fighters. He basically says, when you don't know what to do, throw it all away and start from the beginning. Start from scratch. The significant problems we face cannot be solved at the same level of thinking we were at when we created them. All right, well, let's look at both models again. The orthodox model and the holistic model, what's their strengths? Let's combine them. Technical dentistry and material safety. Now, how do we build a causative model? Is the holistic or biological or alternative model, is it causative? Are we treating the causes? Let's go back to our philosophy. What's the diagnosis? The typical diagnosis is mercury fillings plus chronic fatigue equals mercury toxicity. Is that a diagnosis? Let's go back to the fundamental questions. We have to start here. What is health and what is disease? And how does our model bring someone back from a state of disease to health? Well, health starts at birth. And regardless of what the FDA says, that nutrition has no impact on health, okay? We do realize that if you don't feed somebody, they will die. So good nutrition leads to a good immune system, okay? And at that point, you get growth and development, and you get health. This is simple. And it's got to be simple. It's not complex. Well, what is disease? Disease is simply what? Malnutrition. And malnutrition comes from what? Our conditioning. Well, we're this race, so this is what we eat. Okay? Or our ancestors have eaten this all the time. Or this is the standard American diet. And this is what all kids eat. Well, if you're not feeding the system, you're going to have problems with the immune system. And then you're going to have impaired growth and development, and then dysfunction and disease. So basically, what's regeneration? It's working backwards. Rebuild nutrition, rebuild the immune system, and rebuild structure and function, which is what we do. But if we're not treating the other two, we're not treating causes. Now, for nutrition, okay, I'm not making this up. There is already a standardized medical model for nutrition. And it works. It actually has applications, and it's excellent. And we can communicate with physicians in this manner. Primary malnutrition is an impaired dietary intake. Secondary is maldigestion, tertiary malnutrition, impaired metabolism, nutrient excretion, and increased requirements. Okay? Once we know all these, we plug this information into a nice history form So when we're handed the history form, we already know what we're going to find. What about the immune system? Well, we have to know what the immune system's being exposed to. This is like a summary of what the immune system could be exposed to, antigens and microorganisms. Well, the immune system, there's basically 4 identifiable breakdowns in the immune system. First, we have the normal immune system. Then we have depletion of the normal immune elements. Then we have immunodysfunction. And then we have loss of function. And what we're doing as dentists is really assessing the health of the immune system. At the first level, we see dental disease. At the next level, we see oral systemic disease. And what is the oral systemic model? The oral systemic model, everyone's talking about oral systemic infections. That's just part of the equation. There's oral systemic sensitivity from the materials, and there's oral systemic dysfunction. And we have to put together a treatment plan that phase 1 deals with causation therapy. And then we deal with the other issues. And if we do a complete exam, what our goal is to predict what's one of the biggest problems in restoration? Devitalization of teeth. Well, if you do a proper pulpal assessment, which is not in the dental vernacular or taught in dental schools, but if we look closer at pulps, we can come up with an idea of what teeth might become devitalized, and then recommend treatments to strengthen these pulps and strengthen the immune system so that there's less likelihood of teeth becoming devitalized. And how do I know all this? Well, I made these mistakes. Okay? Some of these people could have been people walking out of my practice years ago. But for each person that I messed up, okay, I sat down and said, what went wrong? And tried to fix it in the next. And I found I had books full of things I did wrong. All right? And how do you organize this? You have to organize it into a coherent system. So again, you have to have a causative philosophy, causation related. You have to have these 3 models to do complete dentistry. You have to have the foundations of traditional dentistry. What happened to holistic dentistry? We threw out the baby with the bathwater. And whatever protocols. Once you have the foundations, then all these other techniques, all this technology now comes into play, and we could use it intelligently. What type of patients do I want to attract? The health, the investment, or the wealth conscious? What type of dentist am I? The service, the guild, the commercial? What does the law of attraction tell us? The health conscious patient is going to go to the service-oriented dentist. Here. And what are they looking for? A healer with the same philosophy, excellence. They don't want mediocrity in dentistry. You have to have proper records, as was being said before. You have to know what you're doing. Okay? Innovation, solving the problems of causality. We don't need a new magic bullet. What we just need to know is what caused the problem, and then we can solve it. And cooperation. I want my life back. A dental tragedy. How do we help her get back to a state of harmonia? Here. We have to go back ourselves. We have to do the soul searching. All right? Professionalism. What is our role? Which one of those 4 types are we? And it's not about what I think I am. It's about what my results say that I am. What I put into my work. Ethics. Are we whole? Philosophy. Are we in the box with symptomatic therapy, or are we outside of the box? What keeps us in the box? Peer pressure. What will my colleagues say? Spousal pressure. You're doing what? My lifestyle is going to do what? Employee pressure, okay? Why change a system that's not broken? If we have never been outside of the box, how do we know when we get there? All right? State of self-fulfillment. No negative emotions. I'm doing the right thing. I don't care what my colleagues say. My patients are happy. Integrity, health, a sense of inner peace, and wholeness, a sense of who I am, not what others want me to be. This is kind of my logo because this is where I try to put my brain. In a society where there was no conditioning, there were no political agendas, and a plethora of intellectual ideas and activity just blossomed and actually created Western Civ. My final quote here. Why so hard? The charcoal once said to the diamond, for are we not close relations? Why so soft, O my brothers? Thus I ask you, for are you not my brothers? Why so soft, so unresisting and yielding? Why is there so much denial and abnegation in your hearts, so little faith in your glances? And if you will not be faiths, if you will not be inexorable, how can you conquer with me? And if your hardness will not flash and cut to pieces, how can you one day create with me? And we're talking about creating health. For creators are hard, and it must seem bliss to you to press upon the hand of millennia as upon wax, bliss to write upon the will of millennia as upon metal. Harder than metal, nobler than metal. Only the noblest is perfectly hard. This new law table do I put over you. O my brothers, become hard. Nietzsche. I know that all of you do comprehensive diagnoses, and you don't ascribe to this non-metal school, of which there's no such thing, or the golden school. But I'm sure that everyone does a structural, functional, dental velar, and aesthetic exam, and you determine what each tooth needs, okay, functionally. All right? And there's still a need for gold in some cases, because I didn't even show the cosmetic cases here that had to be redone. All right? But at any rate, Argent is coming out with a new series of golds. They're called the biosystemic alloys. This is biosystemic 2 for crowns, 99.7% gold. And it's easy to remember, biosystemic 2. Paul Casson in his book helped develop these, and he's written the latest chapter in the Phillip Science of Dental Materials. He's vice president of Argent. Biosystemic 3. Well, ceramo metal classification 3 is for bridges. All right, so you don't have to remember any fancy names. 88% gold, 9% platinum. A lot of these are metals that in these small quantities don't elicit an IgG or an IgM reaction. Biosystemic 4. Ceramo metal for implants, for long span bridges, for posterior bridges. And the fluxes and the solders for these, you can use electrical soldering, so you don't have to use anything with fluoride in it. Biosystemic CG, cast gold, 2. What are the indications? You don't even have to memorize these. This is just from dental school. Look, inlays and onlays. Cast gold 4. Biocompatible for long span bridges, implants.
The question was, how do you handle the child with the caries?
Okay. That was worked through with, believe it or not, 4 or 5 different people. So somebody was doing ART, somebody was doing nutritional therapy with the ART. So there were 2 or 3 people all trying to get consistent information. The bottom line was she was diagnosed with Lyme disease. And when the Lyme disease was treated, the caries stopped. So the solution was out of the box. And actually after that, I had 4 or 5 other children come in with the same problem. And we already had the referrals and everything set up. And 4 out of 5 of those, their caries stopped almost immediately. No one was tested I think 1 or 2 actually went to get the blood tests. And what happened was the blood test, I think, came up negative. Energetically, they came up positive. They were treated nutritionally, and they were treated for the Lyme disease, of course, outside of my office. And the result was that it was successful. I don't know about out here, but Lyme is pretty rampant where I am. And part of our protocols is to go through all these. Each case failure, it's sort of like an algorithm that we put together, and each case failure tells us something missing from the algorithm.
I just wanted to comment on the Lyme disease thing. There's several doctors in Eastern Washington who are being MDs who are being attacked by Quackwatch, and one of their big complaints is that they are overdiagnosing Lyme's disease. But these guys are finding it all the time.
This is, Phil, more of a comment than a question. I think you've thrown down a challenge to all of us to become Renaissance men and women beyond the limited scope of our professional education. I mean, your obvious interest in philosophy and reading outside the profession has impacted it greatly. So the application of a science is an art, and I just want to acknowledge how you've taken your profession to a much higher level than any of us were really exposed to in our professional education, and it challenges all of us to broaden our perspectives on not being the traditional doctor. In the Greek model, why Apollo was the doctor and the musician, and I see that a lot in medicine with doctors too, the ones that really take the challenge and be what they can be. So I appreciate the example you're setting for all of us, and it challenges us all to really become students again.
Oh, another thing, I just want to let people know, I have no vested interest in these alloys. I called up the company and suggested it to them, and suggested some formulas based on the work by Jess Clifford, and they ran them through their computers and came up with these. And I think in dentistry we have to be, I put out there, my interest is in the school. All right, something like this is, we have to work more towards helping humanity. This is out there. I told them I want no interest in this. It's, what I'm hoping is that a lot of dentists, and the ones who aren't sitting in this room, all right, will maybe start using these, because it's almost like a no-brainer. All right, so we can get some of our colleagues to use some of these better alloys. But from what I understand, the Germans are much more ahead of us in using these alloys. And over here, we need to get it going.